Good evening once again, and thank you for staying with us for CBS 6 News at 5:30. I'm Liz Bishop. Cody is off tonight. Well, get ready to pay higher premiums for your health insurance next year. Insurers here in New York just submitted their plans to the state for 2015, and on average, they're looking to raise rates by about 13%. Our investigative reporter Jennifer Lucia has been digging into the numbers for us, and she joins us now with the real deal on what's behind these increases. Looking forward to this, Jen.
Yeah, well, you won't be, Liz. Most of us are getting used to annual increases when it comes to how much we're paying for health insurance, and it appears the next time open enrollment rolls around, it's going to be business as usual.
Hello, Miss Jackson.
When it comes to what you can expect to pay for your medical premiums next year, here's the real deal.
It probably is higher than last year, but lower than the prior 3 or 4 years for sure.
Higher this year. The Health Plan Association of New York represents insurers and says the reason behind what's likely to be at least a 10% hike for most of us boils down to this: rising hospital costs, an increase in sick patients, and rising drug costs.
And speaking of medications, every time a new drug comes on the market that's covered by insurance, it isn't cheap.
There's been a lot in the news about a drug called Sovaldi for Hep C. It's $1,000 a pill. It costs $84,000 to treat one individual for hepatitis C.
And those costs get spread amongst us all. But really, there are a few other big reasons why premiums are high, and it has nothing to do with the insurance companies themselves.
New York State is already 22% above the national average per capita when it comes to spending on health care. Why?
Well, one of the factors is we charge a lot in terms of state taxes.
And now there are additional federal mandates, too.
Is there anything drastic on the horizon that may work in actually at least maintaining rates, if not decreasing them?
I think the big change that's being talked about in the system is really to move, instead of from a payment for services, for volume, it's to pay for value, and to try and have the providers, whether doctors or hospitals, and the health plans working more closely together.
Now, the state insurance department is looking at ways to try and do that. This is a report it just released this week about possible payment reform systems. But again, this is years off, so we're going to have to deal with these increases at least probably through the next several years. Again, if you can expect an increase if you have private insurance, if you're in one of those health exchanges set up under the Affordable Care Act, you might be wondering if you'll see that increase too. The answer is yes, but I'll have way more on that coming up at 6:30 tonight. Liz.
All right, Jen, thanks.